I'm Dr. Simon Rosenberg, the high-tech dentist, and as many of you know, I utilize a number of high-tech modalities in my practice. There are cases where an implant has lost bone on one particular surface or seems to be losing bone, and others have reported. I have no experience with it as yet. I've cleaned a few of the teeth that have some of the threads exposed, but we're actually able to go in and try to clean around. There's some good research to show that those implants are able to be saved by cleaning. We also, instead of having to cut, we can identify where the implant is if we're going from the implant with a cover screw to putting in a healing abutment. Sometimes we find that the bone has grown over the implant edge, and we're actually able to do osseous recontouring, pushback, and dissolve away the bone. And again, if we have to try to get a better emergence profile, we sometimes will take the socket around the healing abutment and do selective recontouring surgery. And then one of the things that is, for me, the biggest practice builder is the ability to put on a laser bandage. I have patients who come in with an aphthous ulcer, canker sore. Patients who come and say, you know, I know that I'm coming down with herpes, I can see the swelling, I feel the tingling. And again, with the use of the iPlus Biolase, we're able to treat those lesions in about 1.5 to 3 minutes, very low power, and by heating the tissue gently and the penetration, the proteins of the infected cells are changed, and patients report instead of 7 to 10 days of eruption, bleeding, crusting, that many of these never ulcerate, they never bleed, they never crust over, they just go to healing. We're able to do the same things with, again, the canker sores. Take away the pain immediately, and instead of waiting 5 to 7 days for it to heal, the patients find that they're healing within 24 to 48 hours. And again, one final thing that we use day in and day out is troughing when we're trying to get a good impression of a crown preparation. If some of the tissue has grown up where a filling has been lost, then we're able to go in and to clean around that. And then by switching the setting, if there's a little bit of oozing, we're able to gain hemostasis. The biggest thing is keeping it in the operatory, keeping it set up so that all I have to do, the same way that I pick up a high-speed handpiece or a low-speed handpiece or my electric handpiece or the air water syringe for any of the dental tasks I have to do, it's fantastic to be able to just pick up, punch in the selection, and do the next step for the patient in a smooth flow, flawless way. So that's been my report on the iPlus.